Depression after surgery, a common but treatable condition. This video is for information purposes only and should not be used as an alternative to or constitute medical advice and seeing your doctor. You've gone through a successful surgery but yet you're feeling depressed. Is this normal? After surgery, it is common to experience a range of emotions, including feelings of sadness, worthlessness, anxiety, and being overwhelmed. These feelings are normal and should not be cause for alarm. However, if you or someone you know experiences more than fleeting feelings of depression after surgery, it is important to seek professional medical advice. Reasons that contribute to depression after surgery. The risk of depression after surgery can be attributed to a number of factors, including the emotional stress of the surgery itself, the side effects of anesthesia, and the physical limitations that come with postoperative recovery. The effects of anesthesia can also contribute to anxiety and depression. Additionally, reactions to antibiotics and other medications can lead to anxiety and depression. Anxiety is a close relative, if you will, of depression. Anxiety is more than just feeling nervous or worried. It can cause physical symptoms such as racing heart, sweating, trembling, nausea, and shortness of breath. Anxiety can arise from a variety of sources, including concerns about the surgery itself, worries about complications, fear of the unknown, and what seems like never-ending questions swirling around in your head. Questions like, who's going to pay my bills? When will I get back to work, to be able to pay the bills? Will my health insurance pay for the surgery? What happens if something happens to me when no one is here to help? And if you let your mind continue down the path of anxiety, you can come up with so many what-if scenarios. Be assured that many people have these types of anxious feelings following surgery. Some surgeries have a higher risk of depression. As discussed in the study, Depression and Postoperative Complications, an overview, certain types of surgery see a higher rate of depression afterward. 3 of these surgeries include heart surgery, spinal surgery, and bariatric surgery. In another study, it was found that women undergoing a mastectomy for breast cancer experienced depression more frequently than healthy people, but that depression lifted in the post-op period. Signs of depression. Depression is a serious mental health condition that affects millions of people worldwide. It can cause a range of symptoms that can impact your daily life. Here are some common signs of depression. Loss of interest in previously enjoyed activities or hobbies, feeling sad or hopeless, irritability and restlessness, increase or loss of appetite, difficulty sleeping or excessive sleeping, fatigue or lack of energy, feelings of guilt or worthlessness, difficulty making decisions, thoughts of suicide or hurting oneself or others. It's important to note that not everyone with depression will experience all of these symptoms. Some people may only have a few, while others may have many. Be assured, in most cases, as you move along in your recovery process, these very signs and feelings should begin to shift. How is that? As your pain lessens, as you're able to sleep better, as you can do more for yourself, as you get back to your normal activities, your feelings of postoperative depression and that cloud of darkness should start to lift. Ways to help yourself. So, you've identified that you have depression symptoms after surgery, or perhaps you are being flooded with anxiety. What can you do to begin to feel better? Nutrition. Be sure you are eating a well-balanced, healthy diet. Try to eliminate sugar, or at least limit the amount of sugar. Sugar, in itself, can set you on a roller coaster of feeling up and then crashing. Limit processed foods. What are some examples of these? Hot dogs, frozen dinners, and bacon. These are just a few examples of processed foods, there are many more. Don't limit protein because protein helps restore muscle and muscle growth. Drinking enough water. A good measure of water intake is aiming for half your body weight in ounces of water. Sleep. Getting enough sleep can be tough when you're still recovering and have postoperative pain. Medications can interfere with sleep. So be sure to take naps during the day if your sleep is interrupted throughout the night. Exercise. Exercise has been proven to aid in the production of endorphins, which in turn, lift your mood. What type of exercise? Well, first and foremost, you want to ask your doctor. As you progress through your recovery, you can also increase the amount of exercise and incorporate other types of exercise into your program: yoga, walking with the goals of further or longer time increments, biking, even stationary bikes if needed, and at some time in your recovery, you may be able to resume weight workouts, but again confer with your doctor and get his release for any exercise. Medication. It is common to be prescribed medication after surgery to help alleviate pain. It is important to take the prescribed amount and communicate any concerns with your doctor. Abruptly stopping medication can lead to dangerous withdrawal symptoms, so it is important to follow your doctor's instructions. FAQs. How common is depression after surgery? Postoperative depression is a common condition that affects many people after surgery. The occurrence of depression after surgery varies depending on the type of surgery, but studies have shown that up to 20% of patients may experience depression after surgery. What are the risk factors for developing postoperative depression? There are several risk factors that may increase the likelihood of developing postoperative depression. These may include a history of depression or other mental health conditions, a family history of depression, a lack of social support, and a history of substance abuse. What is the outlook for people with postoperative depression? The outlook for people with postoperative depression is generally positive with appropriate treatment. Many people are able to recover from postoperative depression and return to their normal activities. However, it is important to seek treatment as soon as possible to prevent the condition from worsening. Conclusion. Is it normal to feel depressed after surgery? Depression after surgery is not uncommon. So many things are going on with your body after undergoing surgery that it's surprising that more people don't experience depression. It's true, feelings are nothing more than feelings, but those very feelings can be intense. Always talk with someone if you continue to feel depressed or have thoughts of harming yourself. As you progress through your recovery, those feelings of depression and anxiety should start to lift, especially if you take steps to conquer them. Remember, it's important to talk to your healthcare professional if you are experiencing symptoms of depression after surgery. It's imperative to get proper treatment. Always talk with someone if you continue to feel depressed or have thoughts of harming yourself. Thank you for watching. To read the full article, go to livingyourseniorlife.com. The link can be found in the video description.